Hi, Andrew. How are you today?
I'm good. You?
I'm fantastic. My name is Talon and I'm here to talk to you a little bit about your pain. First off, I wanted to discuss your goals. What are you looking to get out of therapy, and what specific goals do you have, activities in mind that you do in your daily life?
Well, I've been having some low back pain recently. So that definitely flares up and pretty simplistically just gets in the way of me getting everyday stuff done, whether it's chores or whatnot. So I just want my quality of life back. So
So you're saying that pain has kind of affected those activities quite a bit?
yeah, that's a good way to put it. Yeah.
Okay. And did you do something specifically, or did the low back pain just kind of, has it just been bothering you for quite a bit,
It,
quite a
it
long time?
yeah, it just came up. I don't know what made it come up. So yeah.
Okay. Do you know a lot about pain, or is it just kind of the general pain is pain?
I mean, I experienced a lot of it, but not really in the nitty-gritty part of it.
Okay, well, I'm just going to describe it a little bit to you. So there are two basic types of pain. There's acute pain, which happens quickly and goes away quickly. And then there's also chronic pain, which is pain that lasts longer than 6 months typically. And that's kind of what I'm getting from the case in your situation here. But what happens when you have pain is your nerves act like a telephone line. When an injury happens on one side, it'll it'll call the brain. And that's when it lets the brain know that there's an injury or there's trauma, yada, yada.
So there's constant
And
communication back and forth.
constant communication, yes. Now, pain is not always caused by injury, and injuries do not always cause pain. And that phrase can kind of, you could be like, what are you talking about? Well, when you bump your arm and then you have a bruise appear in the morning, that didn't really cause you pain, but there was still an injury that happened. That's an injury without pain. In your case, you had no specific injury, but there is still pain.
Okay.
Does that make sense to you?
Yeah, yeah, it kind of does. Yeah.
Okay. There's many different types of pain also, and I just wanted to let you know that all pain is real, and I'm here to help you overcome that pain. Pain is a predictor to what is going on, and there's an unwritten rule with physical therapists that if we can reproduce that pain, there's a good chance we can help or send you to the appropriate specialty to help you. Do you have any questions about that?
No, you did a good job explaining it.
Okay, and then our goal here is to reduce that pain with activity and other therapeutic interventions to get you back to that pain-free lifestyle and everyday life, just like those activities you were saying that you really haven't been able to do because that pain's been really affecting you. And studies actually show that exercise can reduce pain in multiple ways. First, the movement of muscles helps push inflammation out of inflamed areas that can be putting pressure on those nerves, causing that telephone call to your brain, just like we discussed before. Exercise also has positive effects on mood, reducing stress and depression, and also improves overall functionality, which is kind of what we want to get out of therapy is reduce that pain and then allow you to do those things that you wanted to do before. And when paired with therapeutic modalities like massage or soft tissue mobilization, which are two things that we specialize in, it's been shown to be even more effective. And we plan to perform activities like the activities you want to get back to do in order to show you your progression and allow you to know that you can now do and perform those tasks again. So it's kind of builds up that confidence by kind of taking the activities that you want to do and we do them or exercises that kind of coincide with those activities so that you know, hey, I can actually do the things I want to do again. Do you have any questions about that?
No, nope.
Okay, so that's overall what therapy is going to look like. And that's a little bit of just kind of a summarization of the pain you feel. And yeah, we could, that's kind of what we're going to get started. We'll kind of get you scheduled for next week. We'll do an initial eval and then we'll just kind of hit it on the head and just get after it. How do you feel about that?
I feel after you explaining it, I feel pretty comfortable in your hands. I feel like you've done this a few times.
Yeah, we have, and it's a real thing, and low back pain's very prevalent in lots of the population, and it's just kind of it can be caused by a bunch of different things, and it's just kind of figuring out what set it off, and then kind of getting after the exercises and the therapeutic interventions to kind of get you back out of it in a non-pharmaceutical way, because a lot of people want to prescribe medications, and then you have to worry about operating machinery, and if we can help you out with physical therapy, I think it's just going to be a lot better of an outcome for you.
Yeah, it's just been kind of just I don't know. It felt kind of heartbroken lately because my wife, she says that it's all in my head when I'm having all this pain and like it really is limiting me. So, but she just doesn't understand that. So,
Yeah, and a lot of people say that, but like we described before, pain, there's all kinds of different pain, and it's not just in your head, because obviously there's something that's having that telephone call where your nerves are telling your brain, hey, there's something going on down here. I don't really, it's just letting it know. And the fact that people say it's just in your head really just isn't a very accurate way of describing it, because you're feeling pain and it's coming from somewhere. So just realizing that your pain is real, and we're going to do the best we can to kind of help you get out of that pain, and improve is the biggest thing that is our biggest goal here.
okay, perfect.
Awesome. We'll see you later.
Okay, thanks.